Hello, and welcome to this National MS Education Awareness Month teleconference. This conference is hosted by MS FOCUS, the Multiple Sclerosis Foundation, and made possible with support from EMD Serono, Genentech, Mylan, Novartis Pharmaceuticals, and Sanofi Genzyme. I'm your host, Casey Minnis, Director of Communications for MS FOCUS, and I'm joined by Cherie Binns, who will be talking with us about advocating for patient-centered care. Before we get to the program, let me just mention there are slides accompanying this presentation, and at the end of Cherie's presentation, we'll also have a brief question and answer discussion. To view the slides and to submit your questions via chat, please connect to the teleconferences online. You go to readytalk.com and join with the access code 7766805. That's readytalk.com. Click Join and use the access code 7766805. Now, let me tell you a little bit about our speaker. Cherie Binns has been a registered nurse since 1973 and an MS certified nurse since 2003. She also happens to have MS. Cherie was diagnosed in 1994 and pursued and received the MS Certified Nursing Certification 9 years later. For the past 15 years, Cherie has operated a home-based patient advocacy business, helping people identify the questions they need to ask of their healthcare team. She's a frequent speaker on the MS Focus at Sea cruises and will be a part of our faculty for 2019. She and her husband David have been happily married for more than 40 years, and together they enjoy spending time with their 2 adult daughters and 4 grandchildren. Cherie, it's a pleasure to have you tonight. Thank you for being with us, and I'll turn it over to you.
Thank you, Casey. I hope everybody can hear okay. If you can't, please type that into the chat box. I did notice some breaking up of Casey's sound, so I just want to be sure that we're clear. In the last probably decade, maybe 8 to 10 years, we're hearing a lot about patient-centered care. In the MS arena, we're hearing a lot about personalized care. I think that tonight's presentation is maybe going to help you get a handle on what the words that you're hearing may mean. Next slide, please. I think it's most important that you realize that you know you better than anybody else does. So take a moment when you're with a member of your healthcare team to introduce yourself if they don't know you well enough already. Let them know about your lifestyle, your preferences for care. If you're on a medication that is giving you difficulty, please let them know about any unpleasant side effects you're having. There are often ways to manage those side effects without necessarily changing the medication. I've found that when I'm having side effects from my medication, oftentimes something as simple as a little extra water helps. Just being well hydrated helps to knock down some of those nastier side effects of medications. When I say, is the plan of care burdensome, I mean, is it really difficult for you to follow the plan that you've been asked to follow? Why is it difficult? Talk about the reasons why. If, for example, you've got to take a medicine on an empty stomach and then you've got to take another medicine 2 hours after eating, it's possible that things can be worked out so that there isn't the chance of missing medications so much by having to work around this sort of thing. So please be open about what's not working well for you. Are there dietary, religious, or cultural reasons why a treatment might not work for you? Basically, if there's anything that you're asked to do that doesn't sit right, either because you don't understand it or because it's against what you feel you should be doing, make that known. put yourself in the center of that plan of care so that your needs and your goals and your desires are known. Next slide, Casey. One of the things that I'm hearing a lot from physicians is that people are always bringing printouts from their computer with them. It's like they come into the visit wanting something that they haven't even discussed with their doctor yet. And doctors are beginning to adjust to that, but this little cartoon kind of represents a lot of where we were 5 years ago. Not so much where we are today. Patients know more about their diseases than I do. I have to get a faster modem, higher internet speed access than they do. Where are the ideas that we're getting for our health care coming from, and how are we going to relate them to our healthcare teams so that they can best help us? Next slide. Having your questions and concerns in writing, stating briefly if possible, avoids confusion and frustration when you get to the visit. Always have a list of your current medications and over-the-counter supplements with you. Make sure that it's in writing. I usually make up 2 lists when I go to the doctor, 1 sheet for me and 1 sheet to stay in the office. That way, as I'm sitting and visiting with the doctor, with the nurse practitioner or the PA, they have a list of my medications, my concerns, and my questions. And they don't have to guess at them. They're not mind readers, so just keep that in mind. Next slide. This is kind of the way that I write things up when I go to the doctor. I list the name, date of birth, the doctor that I'm seeing, the date of the visit. For me, I keep it on my letterhead just so that they are aware who they're talking to. This document is available if you want to email me. My email is at the top of this page, but I will be showing it again at the end of the evening. I can send it to you in a rewritable Word document. All you have to do is ask. I do answer my emails. So I did mention that you want to list your over-the-counter meds. Here I've listed vitamin D, 2,000 milligrams, 2,000 international units daily. Be sure if you're taking a multivitamin that you list it. If you're using something like CBD oil or medical marijuana, please note that in this list so that it can be listed with all of your medications and we can more readily help you with what's going on. Then try to list a couple of concerns, maybe even 3, to be dealt with at that visit. This person, fake person here, but so like many of us, is taking gabapentin or Neurontin. They're also on baclofen to deal with spasticity. One of the concerns that you might have if you're on these medications is that you're tired and your mouth is dry. You don't have any energy. Maybe your spasticity for which you're taking the baclofen isn't well managed. Feels like you're not moving as well as you should. And then take those concerns after you've had a chance to talk about them a little bit and develop 2, maybe 3 questions to deal with at that visit. I tell people if they can't put their questions, maybe they've got a dozen questions, but if you really look at them closely, they often will fit into 2 or 3 categories or questions, so you can sort of lump the categories together into a question. Is there anything else to help with spasticity? And it may get you talking about a different medication, or it may get you talking about stretching exercises, or perhaps even if your spasticity is really bad, something like a pump to help deliver a very small amount of medication without the side effects that oral meds do directly to the spinal cord where it's needed to help with spasticity. Ask about physical therapy. I generally go at least once a year to a physical therapist because something that I feel is normal for me with other eyes on sometimes can look like it needs a little tweaking or a little fixing. And somebody else's eyes are just oftentimes the thing that we need, because we often are so aware of, or so unaware that what's going on is maybe alterable. We don't need to worry about exactly what's happening. We can get other eyes on this. Next slide, Casey. People diagnosed with MS want to know more. What's going to happen to me next? Can I still work? Where can I get answers to my questions? Does this mean I can't have a baby? Will I need a wheelchair or a cane to get around? A lot of these questions come from a vision that we had of MS before there were any medications available to treat it. Back when I went to nursing school, there was nothing to treat medication. When my first symptoms showed up, there was nothing to treat MS. So I wasn't diagnosed because my doctors actually tell me after the fact that they knew that that's what I had, but since there was nothing to treat it, why tell me? So we sort of have this vision of people in wheelchairs, people bedbound, people that are just not functioning well. However, in today's environment, when we're diagnosing earlier and getting people on medication to stop the progression early, we're not seeing this as much. As long as people are getting on a medication early and staying on it, we're really seeing people active for 20, 30 or more years. So don't hesitate to have that discussion with your doctor. Does it mean you can never have a baby? No. People who are pregnant tell us that they feel better while they're pregnant than they ever did when they weren't pregnant. There's a hormone that's produced during pregnancy that gives a real sense of well-being and seems to knock down the MS symptoms. So don't let your fears take over. Put them into words and talk about them. Go ahead, Casey. Next slide. This particular slide was used as part of a presentation at the Consortium of Multiple Sclerosis Centers last May. We had a talk on what an ideal comprehensive MS center would look like. And the patient voice was put into this talk throughout the entire talk. There were people from all over the country living with MS who gave examples of what they would put into a comprehensive MS center. Should it offer access for MRI, physical therapy, lab, nursing, social workers, and more? Were the questions that we were asked. And I guess there were probably 12.5, maybe 24 people who turned in their responses, used the patient-centered voice to help explain to neurologists what it is that we as people with a disease need when we go to the doctor. My main response was that I tend to be very busy and I don't like sitting on hold on the telephone. My neurologist is very, very responsive to emails, so generally if I email something to him, I get an answer back sometimes within 30 minutes, but generally within 4 hours at the outset. And that can save a great deal of time and cost with the immediacy of help that email provides. Next. Earlier this year I was going to say, but it was towards the end of last year, I was reading something and came across the commencement address for Wellesley College that was given last May. Tala Nashwati was the student commencement speaker, and she is the daughter of Syrian immigrants. She was chosen by her classmates to give the commencement address. Wellesley has this way of doing things where at commencement every year a class is assigned a color. This year her color was green. And she stated to the class that looking out over the class, she saw this big sea of green stoles ahead of her. And she talked about it was kind of like looking out onto a sea of emeralds. And then I put this quote from her speech here. Like us, emeralds are valuable. They're rare. They're pretty durable. But there's something else emeralds are known for. Their flaws. We all have a lot of flaws. We are incomplete, scratched up in some places, jagged around the edges. Still, it's nearly impossible to find a completely flawless emerald. Flawed emeralds are sometimes even better than flawless ones because the flaws show authenticity and character. Next slide, please. I've put up a slide of some different ways that emeralds are seen by us. The first is a raw, uncut emerald. And as you can see, it doesn't look very special. But as it's cut and reworked, it reflects light in many different ways. You can see, though, in these pictures that there are scratches beneath the surface or bubbles in the round one. Those scratches and bubbles reflect light in different ways and actually make it a more beautiful stone. In the same way, next slide, our scratches, our faults actually make our voice, make our story more shining. It brings out things that are very valuable in what we're saying. Don't hesitate to use that voice. It lends a real authenticity. It can help make not only your health care better, but it can make research on your behalf better. Casey, next slide. I want to talk to you for a minute about ways that you can use your voice to make research better as well as making the healthcare situation better. iConquerMS is a group that is a patient-powered research organization that was formed about 3 years ago to promote research that is important to people with MS. Next slide. It's an online community of people who live with MS and others who want to find a cure and are willing to help by sharing health information and completing surveys. We're part of a larger national effort to change how research is done, putting patients at the center of the research agenda through PCORI, which is the Patient-Centered Outcomes Research Institute. I'll be talking a little bit more about that in a couple of slides. iConquerMS is an initiative by people and for people living with multiple sclerosis, and it's focused on research that matters most to us, the MS community. We don't necessarily want a cure immediately. We want to feel better. We want to have less impact of the symptoms of MS, less impact from the medications we're taking. We want to be able to do things that we love to do, that we used to love to do, that we would like to do again. And so more and more research is being directed by people living with diseases that helps them to live a fuller, better quality life. And iConquerMS is one of those things. You can go to the website, which I will give at the end of this talk. It's basically just iConquerMS.org. It doesn't cost anything to join. In that 3 years we've been in existence, there are a little over 4,000 of us. Most of our governance is by persons living with MS. We have 3 committees, a governing board, which has 9 people on it. 6 of those are living with MS. Our research committee, 11 people with 6 having MS. And an engagement committee, again, 9 with 5 having MS. We also have a lot of advisors working with us who have MS or work with people with MS. So it's a very real day-to-day organization that is working to try to better the lot of those living with MS. Next slide. iConquerMS was created by the Accelerated Cure Project, which has been in existence as a not-for-profit for about 15 years. That group started with a hope that by working with researchers, we could get people to share their information that they had gotten during research. We're finding researchers are very selfish people sometimes. They're guarded. They want to protect the information that they've gotten until it can be patented and made known. But the whole goal of this is that we won't work with researchers that don't agree to share the information that they got through their research, whether or not they got the information that they were hoping to get. We are recognized and supported by all of the major service organizations for multiple sclerosis, including the Multiple Sclerosis Foundation. Not listed on here, but also supporting us, are the International Organization of Multiple Sclerosis Nurses. They are the organization that does the certification exams and makes sure that we keep up on our continuing education in order to recertify. The Consortium of Multiple Sclerosis Centers also recognizes us, and they are the largest group here in the United States of neurologists and nurses and rehab specialists that are dedicated solely to the care of the person with multiple sclerosis. Next slide. My data, your data, has power. Large amounts of information allow researchers to gain new insights into MS. One of the things that we're doing with iConquerMS is we're sending out surveys every 6 months. They may seem repetitive when in fact they are. We're not asking you for your demographic information or your name and your street address and your date of birth and your gender and all that kind of thing every 6 months, but we are asking you about things like symptom management. Is your fatigue level under control, or is it oppressive? And we look at your answers from 6 months before compared to your answers today, compared to your answers 6 months from now, and putting those 4,000 plus responses together, we're able to see patterns developing. Perhaps it's relating to medication that you're on or to specific activities that you're doing. We're asking questions now about things like supplements that you use or alternative and complementary therapies such as acupuncture or massage or chiropractic or electrical stimulation or magnet therapy, any number of things like that. We're asking if you follow any particular type of diet. Are you trying to keep low fat, high fiber? Are you following a basic WALS protocol? What is it that you're doing? And if you're doing something different, how does that look in the way that you're feeling, in the way that you're acting, in the way that you're living your life? And over time, these questions being repeatedly asked are, again, beginning to show patterns. So I encourage you to log into that and share your data. Help us to see the patterns, because those patterns also help to know which medication to treat you with. Next slide. I mentioned as we were talking just a moment ago about PCORI. PCORI, P-C-O-R-I, the Patient-Centered Outcomes Research Initiative, was started in 2010 as a component of the Affordable Care Act. Now, people look at the Affordable Care Act and they think Obamacare. They think it's a product of the Democrats. PCORI, however, was an idea that had been brought to the table many times before, really championed by a Republican senator from the South who felt that patients were not being listened to, that the research that was being done didn't have the patient in the center of what was going on, didn't have feedback as to whether or not the research that was being done was something that the people who would benefit from it ultimately were really interested, or whether it was something that was being imposed upon people. So PCORI was begun, and it was funded through a trust to provide monies for research that had a patient voice at the center of it. People were not getting funding for their projects unless they were working with patients, unless they were hearing what people had to say and acting on that. So it was a source of funding that opened up, but it made it known that the patient voice, patient-centered, was really what was needed in order to move forward with this new funding source. Next slide, Casey. There are a number of ways that if you're interested in getting involved with this, you can participate in. PCORI has a program for ambassadors, people that learn the ins and outs of what PCORI is, the basic tenets of how to get patients involved, how to get that patient voice put forward. There's also the opportunity for you and me, anybody that's listening to the sound of my voice, to be a reviewer of research before it's proposed or before it's actually funded, when there's what we call a letter of intent out there. We are asked to review those letters of intent to see if the research that is being proposed is something that would mean something to you or to me. And if so, what is it that looks best about this letter of intent? What's missing here? What are they not hearing or seeing that should be in? There's also room to serve on various advisory boards for people that are looking for ways to get the patient voice involved. Now, at the end of this talk, I will again be putting this website, www.pcori.org, up. So there'll be time enough for you to write some of these down. And I believe that the slide deck will be made available on request. I'm not 100% positive about that, but I think we can certainly make that available to you if you want it. Next slide. So many people were interested in, intrigued by, and empowered by PCORI that a group called PCORNet, Patient-Centered Outcomes Research Network, was formed. There are 20 patient-powered research networks that are part of this network. Many of them are disease-oriented. There is not only a network for MS, there's a network for Crohn's, colitis, irritable bowel. There's a network for arthritic conditions. There's a network for things like autism, genetic disorders. So there are things. MS is not the only disease in each of our lives. It's not the only condition that each of us is dealing with. We often have family members or close friends who have other conditions that are represented here. And it gives us, as people who are concerned, people who are involved, the opportunity to log into these networks, see what's being done, see what's being said, see what help is being offered, and to lend our voice to that. There are also 13 clinical data research networks, which are the big, what we normally look at as research institutions, places like Duke University, Kaiser Permanente. So these are large groups of healthcare organizations that have a lot of resources to do research. And again, they're all listed on the PCORNet website, which is www.pcornet.org. And again, I will put that up at the end of this presentation. Next slide. Perhaps you have been in a position to be an advocate for a family member who has an illness. Many of us have had children or siblings or even parents who have a condition that really needs that extra voice to get them the quality of care that they need. PFCC Partners, which is Patient and Family-Centered Care Partners, was formed several years ago as the result of one woman's efforts to take care of and make sure that her 3 children, who were all born with medical conditions that needed treatment, were taken care of properly. Now, there's really not a whole lot more powerful voice than Mama Bear. The moms who are out there doing their darndest to make sure that their children get the care that they need and that they deserve to thrive. And PFCC Partners was developed as a result of that organization, as a result of that need. It is now growing by leaps and bounds. It started, as I said, by one person. And when I became familiar with this about 2 years ago, there were maybe 150, 200 people that were really active in this. And now there's, with all of the doctors that have joined this partnership to make sure that they're giving the highest quality of care, with the patient voices that have been empowered. By patient voices, I also mean by family members who have become advocates. The network has exploded and is now consisting of several thousand people in various forms of involvement. Next slide. That group has also formed a patient and family advisory network and actually does free webinars once a month, free meetings, where they will bring in people who've done something to bring forward the patient voice. The last one that was done was a group of doctors, nurses, chaplains, social workers, rehab specialists that got together, Duke University and Durham VA, and worked out a plan to look at the elder adult that was getting ready to go in for an elective surgery. And in advance, they did a multidisciplinary look at this person, put a plan of care into place for following the surgery, and put against people who were of similar age and disability or activity levels with similar illnesses. The people who had this interdisciplinary plan prior to surgery generally had far fewer complications and left to independent care a lot sooner than the others. So the PFA network is part of PFCC. There are lots and lots of options open for you to get involved with that, and there are so many resources available to you as to how to bring patient-centered care into your communities, how to start patient advisory councils in your community hospitals, in the practices that take care of you, in the community itself, starting up an patient advisory board in your community, perhaps at the senior center or the community center or a local library. There are so many resources available that I would encourage you, if that's something that you're interested in, to take a look at this next slide and just spend a minute writing down the web addresses or the emails of things that I've spoken about tonight that interest you, that you want to follow through on more. And while that slide is up, I encourage you to go ahead and, if you've got questions for me, start typing them into the chat box. We will be taking questions in just a couple of moments, so get those questions coming in, and Casey will let me know what they are, and we will do our best to answer them for you. So I'm going to go to the next slide, which is our question time, and we'll leave that up for a moment. And then, Casey, at the end of the question time, if you could go back to this previous slide so that the session closes with that slide up, that people can write down things that they may want to capture again.
I can
and
certainly
with that, we'll take the first question.
Okay. As I mentioned earlier, to ask a question, you must connect online. So you go to readytalk.com if you're not already connected, click Join Meeting, and use the access code 7766805. We're asking that you use the chat feature to submit your questions. So if you're already online and you have a question for Cherie, please use the blue chat button to submit your question now. So our first question is from Machika. She said, when you spoke about the surveys that are regularly sent out by iConquerMS, how can I get this survey so I can get involved?
Great question. Thank you. Go to www.iConquerMS.org and just click on the button that says Register. You can sign up to become a member, and as soon as you are logged in as a member, the surveys pop up on a page that becomes your home page, your dashboard. Everything on that dashboard, once you start filling out surveys, is you. You can compare your answers to what the answers in the general network are. So, for example, you may say that you're on a specific medication. You can see how many people in the network are on that medication. You may be 39 years old. You can click on your age and see how many people in the network are your age. There's a lot of things that are available to you once you do that. And it is my understanding that as soon as you've completed that whole set of surveys initially, if you wish, we'll send you a T-shirt. So let us know the size.
Okay. I'll remind everyone we're asking you to please use the chat button if you have a question for Cherie. Cherie, earlier in one of your slides, you said that there was a Word document that people could request from you. For the people who aren't online seeing the slides, can you tell them how to get in touch?
Certainly. It is basically an example of a type of paper that I have started using to take to my doctor visits. It gives me and my doctor a quick visual of what medications I'm on, what supplements I'm taking, if I have any specific concerns that need to be addressed at that visit, and a couple or three questions that I really need answered at that visit. It is in Word format, and if you would like that document so that you can personalize it, email me at CherieBinns@gmail.com, or I'm sorry, CherieMSCN@gmail.com. That's CherieMSCN And Casey will be putting that slide up again at the end of the question and answer period. So if for some reason you missed a digit, you can get that when she puts it back up.
And Cherie, you had a question for me about making the slides available. If it's all right with you, we're happy to do that.
It's fine with me.
So anyone who would like a copy of this evening's slides can email editor@msfocus.org. That's editor@msfocus.org, and we'll get a copy of the slides to you. We'll also be making this presentation with the slides available on our YouTube channel in the coming weeks, so everyone can follow MS Focus on Facebook, Instagram, Twitter, or keep an eye on our news page on our website, msfocus.org, and you'll get the access information for that. Okay, I'm going to give folks one more question opportunity. So again, if you are online and you have a question for Cherie, we ask that you use the blue chat button to submit your questions. We have a comment from our earlier question from Machika, who says, "Thank you very much for that information and looking forward to getting involved."
Wonderful. You know, iConquerMS was one of the first things that I got involved with 3 years ago, beyond the Multiple Sclerosis Foundation, and things started snowballing. The more I got involved with, the more opportunities opened for involvement, and it kind of felt like it gave me a portion of my life back that I thought was gone. So I do encourage you to go to those websites, to go to iConquerMS, to go to PCORI.org, to go to PCORnet.org, to go to PFCCpartners.com, or that's for both the partners group and for the patient and family advocacy group. It's pfcpartners.com. Get involved in those things. You'll find things that tickle your imagination, that give you a sense of wonder and well-being, and that help you to make your voice heard and more powerful.
And with that, we'll end our question and answer session. I've put the references back up, and we'll leave those up for a few minutes as everyone says good night. We've got a comment from Deborah, who says, "Thank you, Cherie. I feel inspired." That's Debbie from San Diego.
Well, thank you. Take that inspiration and get involved. Make your voice heard.
There's so much that people can do to get involved. It is National MS Education Awareness Month, and with our thanks to our sponsors, we have more teleconferences and educational opportunities coming up. We also have our MS awareness kits that are available that give you an opportunity to get involved not just in learning about MS, but also in sharing information. If you go to msfocus.org and click Get Involved under our National MS Education Awareness Month campaign, you'll find the opportunity to order your kit free of charge. And you can this year order extra materials that give the basics about MS to share with people who may not be familiar with the disease. We encourage folks to use that opportunity to use their voice and let other people know about MS and about MS Focus and the services that we offer as well. Well, that's our time for now. Our teleconference series continues Tuesday, March 8th. Or is that a Thursday? March 8th, when MS Certified Nurse Tracy Walker discusses the so-called unmentionable symptoms of MS. I promise you she will be mentioning them. We hope that everyone will join us then. Our sincere thanks to our sponsors for their support of National MS Education Awareness Month, to all our callers and those of you who asked questions and participated, and especially to Cherie. Thank you so much for the time you spent to prepare and share this information, and for all you do to advocate for others with MS. We really appreciate you.
Thank you. I hope we see some of you also at some of our in-person events this month as part of DMS Focus program, because we're going to be meeting in New York and New Jersey and Florida and Virginia and Illinois and California. Any others, Casey?
Oh my. Oregon. I can't even remember them all.
I think that's for this month, those may be the places. But if you're in those areas, look for an invitation to come into your box.
You can also find information about all our events on msfocus.org under events. All right, well, with that, thank you again, everyone. Thank you so much, Cherie, and everybody have a great night.
Thank you.